Hi everyone, welcome back to Postal Prevention, where I'll be interviewing different people from different sectors of the prevention world. Today I'll be interviewing Ronna, the Senior Director of Prevention at SAFE Project, a national nonprofit working to address the addiction and mental health crisis through prevention, education, overdose response, and stigma reduction and recovery initiatives. So with over two decades of experience in youth substance use prevention and community coalition development, Ronna has helped train thousands of youth, educators, parents, and community leaders across the country. So in this conversation I'll be having with Ronna today, she shares her personal journey, insights on prevention, and what the youth can do to make a real impact in their communities. So let's get right into the interview with Ronna. Today I'm joined by Ronna, the Senior Director of Prevention at SAFE Project. Ronna has over 20 years of experience in substance use prevention and has impacted thousands of educators, parents, and young people across the country. Thank you so much for joining me today, Ronna. I really appreciate your time. So I'd like to start off by asking you, can you tell us a little bit about yourself?
Yeah, sure. Thank you so much for having me. I definitely appreciate it. I have, as you mentioned, been an individual that has chosen the career of prevention for in excess of 20 years. And I would tell you that my passion for this work is definitely deeply rooted in my life experiences. No 2 days of my career have been the same. It has been an incredible journey and an opportunity to just really make a difference with young people as well as all community sectors, including parents, workplaces, law enforcement, healthcare. And so I feel like this message around prevention could relate to all of your listeners, no matter what career path or walk of life they're interested in.
Okay. So what personal experiences originally inspired you to start a career in prevention?
Hmm. You know, I would have to say that there are definitely experiences that have played a role. And I didn't realize that until potential years into the career. This field found me as I was a tutor in an adolescent inpatient treatment facility. And what I learned about myself during that journey that kind of drove this path is that growing up, I was a young person that was exposed to adverse childhood experiences, things like serious mental illness in my home, substance abuse, as well as addiction and divorce. And so all of those things coming into play on the as a risk factor on one side. On the other side of the spectrum, I would say that I was so incredibly fortunate to have protective factors to offset this risk and essentially change the trajectory of my life. And I do now see that that is strengthening or has strengthened my commitment to serving others. And so I think that and as I just mentioned to you, having a career working in this field for over 20 years, I've had just that opportunity. It's been very inspiring, and I can draw from my past and lived experience almost every day of my career.
Yeah, I really appreciate you being so like open, sharing your personal experience. It's
Mm,
like really powerful to see how something
you
so
bet.
difficult can turn into like a lifelong purpose. But like that kind of leads on to my next
Yeah.
question. So you've been in the field for quite some time. Has there ever been like a moment that reaffirmed why you do work like this?
I love that you didn't say 20 years.
Yeah,
When you say it that way, 2 decades or 20 years, it seems like it's so long.
right.
Yet, in some regards, it seems like a blink of an eye. And so, I think the most important thing to say is that when you really are passionate about your work, it's ingrained into you. It doesn't even feel like work. And so, when you say, is there one moment that really stands out? There isn't one. There's many, and I think that those many moments are what keep that they inspire me and they fuel me to keep coming back. A message that I would love to share is that for me, I kind of wrap prevention up in this way. For me, this field of prevention has been first and foremost about connection. As I said to you just a couple of minutes ago, it all started whenever I was a tutor in an adolescent inpatient treatment facility. And what I saw is that the students would respond because I was there and I showed up. The common thread with all of them, no matter what route they took to become into the facility, is that they lacked interpersonal connections and life fusions. And I could be that by simply showing up. There were so many other opportunities to connect with people in different walks of life. And I'll tell you more about that when I tell you the next thing. So it's connection first, service second, the ability to give back and to serve others utilizing my gifts, my talents, my skills, and be not only working in the field of prevention, but coalition development and this idea that prevention is important and prevention works best when all come together within a community. So providing services, providing education and skill development has been so much a part of my career. And then the last part of that, I would say, is growth. I've grown personally throughout the course of my career. So it's awesome to say that after 20 years, I'm still growing, learning, and that I'm able to instill in others skills and strength as well. And I can see communities growing. I can see school districts growing. I can see families growing. So for me, I would just say prevention is about connection, service, and growth. And there's so many layers to each one of those key components of this career.
Yeah, I think moments like that are like what really remind people why prevention work matters, especially like when work gets hard. Those moments really help people. Yeah, thank you for sharing that. So, what prevention strategies have consistently proven to be the most effective with youth?
Yeah, so I feel like that's a really good question, and I'm actually really glad that you asked that. The interesting thing is, and I hope you don't mind if I twist this around just a bit,
Yeah, no
in that
problem.
it's very easy to talk about the things that don't. And so when people talk to me about the prevention field or how is it that you can stay in a field for so long, the beautiful part about this career is that the field of prevention is continually evolving and growing, and we're learning every day from lessons learned. And we now integrate science in the field of behavioral science, public health sciences into the work of prevention, and we're no longer just doing random acts from the hip. And what that means is that years ago some people would think that prevention would be a single slogan or a simple message of just say no. And what we've learned from an era of just say no is that just saying no isn't just that easy. And other eras of drug prevention that would say things like this is your brain on drugs. And again, we know that scare tactics don't work. Grotesque images or threats of harm are not the way that are most effective in changing attitudes, beliefs, and ultimately behaviors. And so when you ask what really works, we know what really works is evidence-based and sound programming. This includes education on skill development. It also includes education on behavior rehearsal, practicing the skills they're being taught, having engaging methods, as opposed to young people love to be empowered and to be inspired and to be a part of this, as opposed to being told what to do. So prevention is not a prescribed program. Prevention is not one and done. Prevention is not a scare tactic. Prevention is around more better said, prevention is about beliefs and behaviors that are indicative or supportive of overall health. What are the things that I can do to protect my overall health and my overall wellness? There are areas in our lives where we do this so well. This includes things like prevention around disease. There are times when we get annual immunizations or lifetime immunizations that protect us from different diseases. There are simple steps we take every day. We brush our teeth, we put a seatbelt on, we put sunscreen on. We do all of these things, shame or stigma or reservation. If we don't put our seatbelt on, somebody may even remind us to do that. And so, when it comes to the field of substance use prevention and mental health, there tends to be some stigma there, and there tends to be these rooted beliefs of what used to work. And so, I really invite you and your listeners to embrace a broader scope of prevention and realize that the field is ever evolving, and scientifically sound efforts work better than random acts of one-time messaging or scare tactics.
Yeah, that's actually like that's really helpful to hear because especially coming from someone who's worked directly for like so many years with students and educators, that's pretty helpful. So branching off to what you're saying, so SAFE covers everything from overdose response to family support. How does prevention tie all of these areas together?
Well, what I believe, gosh, that's a great question. I mean, weaving prevention into all the initiatives at Safe Project and with all of the coalition partners I work with has been very much a part of my life's work. And I think that I mentioned to you about connection earlier. Every
Mm.
connection is an opportunity for prevention. And the ultimate goal is to offset risk with protective factors. So, how do we do that? We do it through education, we do it through care and compassion, we do it through stigma reduction. All of these efforts collectively happen in all domains of our lives. And so, whether it's self, taking steps to improve ourself, taking steps to improve our family peer network, our community, and society at large. So it's kind of like this evolution of prevention. And my challenge, my role, my task every day in working with my colleagues and all of the people from communities across the country is to meet them where they are. What are the specific needs that they have? Is it youth programming? Is it parent programming? Is it workplace programming? Is it overdose prevention work? No matter what it might be, the prevention is integrated and an intricate part of all of the work in supporting health and wellness, as well as the onset of disease.
Yeah. So coming back to the youth you're talking about, so you trained thousands of youth. What do you believe youth leaders uniquely bring to prevention efforts?
You're right. I have had an incredible opportunity to work with youth and continue to work with youth, even like you yourself as a member of Safe Project's Youth Voice Council. So thank you so much for being a part of that. I think that youth bring energy, youth bring creativity, and again, even you yourself bring passion to the field. There's different whys behind what bring people to the table, and that variety of work leads us to making a greater impact. So again, remember I said prevention is about a prescribed solution. It's about meeting people where they are and the needs with which they have. And youth know best. Youth know what they need. Youth know what their communities need. And when they're brave to speak up, they have energy, that creativity. We work so well together. And so providing mentorship, providing direction. I work with so many youth in doing anything from small campaigns around international overdose awareness to doing large scale campaigns with prescription drug or at home disposal, or working with young people who are passionate about providing education and skill development and creating programs for their peers, or even mentorship programs where they're going in and working with elementary students. I've worked with students who've done town hall meetings and actually advocated at the county level, or even statewide level for changes in policies around approaches that are more humanistic and taking this approach of providing support and fostering care over punishment. And so I have, there's never been a dull moment in working with young people. And if I have to wrap it all up, I would say again, it's the energy, it's the creativity, and it's a passion for wanting to make a difference.
Right. So like you said, youth knows they know like what's best for them. So I feel like when the message comes from people my age, they have like a bigger impact than coming from an adult because the kids could like directly listen.
Yeah,
Right.
for sure.
So what are like some of the biggest gaps in prevention at the national level right now?
Again, this is a really big question.
Yeah.
And unfortunately, but true, in the 20-year journey that I've been on as a professional in the field of substance use prevention and mental health, I would say that unfortunate, there has been a lack of funding to support efforts in prevention, as well as a lack of priority. And there are many reasons that I believe that are contributing factors for that. One of the things that I would say is a contributing factor is that it's really hard to prove something that's non existent. And so when we implement prevention measures, the results of that work are sometimes very hard to prove. And so let me give you an example. We live in a society where we seem to respond very well to crisis moments. And so we can measure the number of patients that we've treated in an emergency room, for example, who had X number of health conditions. We know why they came, we know how we connected with them or treated them, and we know whether or not they got better. And it's easy to measure that. When it comes to the prevention and the field of substance use prevention, we know how many students we reached, for example. We know what program we used, but we don't always know the end result. And so, until maybe generations down the line, and when we have reductions in overdose numbers or reductions in highway traffic fatalities or reductions in the overall number of people that are using substances. So, because we don't have those immediate results, sometimes there's this challenge of, well, does prevention really work? The other part of it is this notion that prevention didn't work for years. And as I said to you, there's been lessons learned in the field. The field has come a long way from those scare tactics for those information only, and even the war on drugs. These things have been proven to be ineffective and not meeting people where they are with the immediate health concerns that they have. And there's still disparities that aren't being met. And so these factors come into play as to why I believe the field is, unfortunately but true, underutilized and underfunded.
Yeah. So I have one last question for you, Rana, before we like close it up. So what do you hope young people walk away with after
Right
hearing your
on.
talk?
Hmm. Gosh, I would encourage you to think about mental health and substance use and promotion of or prevention around these fields is automatic, right? And so I would say you all have a role in the power of prevention. I can tell you from my own experience that prevention is better together, and that we can together build communities where we're building protective factors that were in place that's changed the trajectory of my life could be you. That's showing care, kindness, and support to others. That's speaking up about the things that are important to you. That's understanding what behaviors are supportive of pro health. So, know what the things are that you need to promote your health and advocate for those things. So, stand up, speak out, be proud, help us to address stigma and help us to integrate, and very much like we integrate other forms of prevention in our lives. As natural as it is for you to wear a seatbelt, as natural as it is for you to brush your teeth, get an immunization, put antivirus software on your computer, all of these things we do naturally. I invite you to come along and support the field of substance use and mental health and make prevention of overdose and make prevention of harm, injury, and disease just as natural with no stigma. That would be a win.
Yeah, thank you so much. And I really think that message will like help the youth like very much. So with that, this has been an amazing conversation. Thank you so much, Rana, for taking the time to share your experience, your knowledge, and your great perspectives. I myself and everyone out there really appreciate all the hard work Safe Project, especially you as a senior director of prevention at the Safe Project, are doing like all the communities across the nation. But thank you, Rana.
You bet. Thank you so much.
Bye, everyone.